Welcome back to Your Health television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and I'm very pleased you could be here for our next segment. During this next segment, this is a special edition about vision and the eye, I'd like to take a few minutes to talk about eyelid surgery, eyelid rejuvenation, and in fact, rejuvenation of the whole periorbital region. When I say periorbital region, I mean that entire region around the eyes, from the lower forehead to the eyebrows to the upper eyelids, to the lower eyelids, and to the cheek area. Now, when I see someone in my office concerned about extra skin or lower eyelid pouches, they may come in and say that they feel like they look tired, but they feel just fine and very energetic. We start with an exam and speaking and consultation. So what I like to do is sit with a patient, sit with a person in front of a mirror while I look at them and they point out to me what it is that they might want to change. Let's start with simple things. Botox, is actually a muscle relaxant, can be very effective with changing the appearance of the periorbital region. For example, in the glabella, that's the area between the eyebrows, people can get what the company calls the 1s or the 11s or the 111s. That's when people give a look of disapproval and they can get a furrow there. That seems to be pretty normal and natural, and to some people actually desired when they feel that way. However, when a person does not feel that way and they still have that look, they'll oftentimes come in and ask me if there's anything they can do. For example, I have had people come in and tell me that their colleagues, their coworkers, tell them that they are afraid that the person looks angry or looks upset or overly tired, or they constantly look like they're disapproving. That may be a sign of somewhat of a hyperactive muscle group in between the eyebrows. That area is called the glabella. There are two main muscle groups, the procerus and the corrugators. The corrugator muscle runs transversely or horizontally. The procerus muscle group runs up and down or vertically. And those are the muscles primarily that we want to relax when we use Botox in the glabella or in between the eyebrows. Botox in this area can be very effective in minimizing furrows. Now, will it give a complete relief? Will it make lines look invisible? Clearly no. However, what we can do is soften existing lines and furrows, and we can certainly minimize the chance that wrinkles and furrows and lines will get worse. So that's one of the most commonly used areas for Botox. That's in the glabella, that's between the eyebrows. Secondly, the areas of the so-called smile lines or laugh lines or crow's feet on the sides of the orbits or the lateral orbital area. It can be very effective for softening those lines. It won't make those lines disappear totally for a number of reasons, but one important reason is when a person smiles, the zygomaticus muscle actually pushes up the cheek tissue, and the soft tissue at the lateral side of the lateral orbit actually sort of folds or becomes like an accordion. Now, in my practice, I do not like to dramatically diminish a person's smile. I think that it's very well worth it to have smile lines and lines of expression. However, the squinting lines that people can get, or when they're sort of giving a look of distress or a look of disapproval, those lines on the side of the eyes can be greatly diminished with the use of Botox. It's predictable and it works very well. Botox is delivered with an injection. My patients like to have ice put on. We can also put a topical cream on. It minimizes the slight discomfort from the needle. It's delivered with a needle and a syringe under clean, almost sterile conditions. And I should mention, of course, the needle and the substance itself and the syringe is completely sterile. We do it in the office while a person is awake with a topical cream application and oftentimes ice before and after. Now, with Botox, we can actually change the position of the brows slightly, and we can affect other structures. For example, the tone of the lower lids. Oftentimes people will have an excess ridge, muscle ridge in the lower lids, and we can soften the lines and soften that muscle bulge very predictably with Botox, doing it conservatively. because we don't want to overshoot and minimize the tone of the lower lid so much that the lid will come down. We do like to maintain a healthy amount of tone in the lower lid, but oftentimes if people have a hyperactive orbicularis oculi muscle in the lower lid, we can soften that quite a bit. Now, what about slightly changing the position of the eyebrows with Botox? The way we do that is to selectively make certain muscles relax and thereby allowing other muscles to go on and act, and so we can change the position of the brows. For example, the major elevators of the eyebrows, it's a muscle called the frontalis. That's how we get these forehead lines, when the frontalis muscle lifts up the brow. I previously mentioned the muscles in the glabella called the procerus and the corrugator. Those are depressors of the brow. Also, the orbicularis oculi can bring the brow down. Hence, if we selectively make the depressors of the brow come down, those three muscles, part of the orbicularis, the procerus, and the corrugator, if we selectively have those muscles relax and we allow the frontalis to take over, then we get a micro brow lift. And typically we do that laterally. In the ideal female form, the ideal female appearance of the brow will have what we call an upwards 2/3 slope. The central part of the eyebrow will slope upward about 2/3, and then at that junction of the lateral third and middle third at about the corner of the eye, there should be a slight angle, either horizontal or coming down, and we want a peak of the brow there. If you flip through the glamour magazines, almost all the models have a peak at the lateral 2/3 point of the eyebrow. For men, I like to be more conservative in brow lifts, even with Botox. We don't want to overly feminize a male brow. A slight upward tilt or bringing up the whole brow in a horizontal fashion can be a more attractive look in the male. So we can actually affect the position of the brow just with Botox. Now, to soften forehead lines, that can also be done with Botox, but I like to do that conservatively because, as I said, the frontalis muscle is the major elevator of the brows, and if we are too overexuberant in getting that muscle to relax, the brows can actually come down. Now, we can use that to our advantage in people who have asymmetric or uneven eyebrows, and that can be effective as well. Now, on to the next tool in our kit. That's fats and fillers. Sometimes we take a person's own fat and we can inject into the lines around the orbit or the furrows. Sometimes we can actually make the brow or the upper cheek look a little bit more chiseled or more defined. That can be very effective. The difference between a fat and a filler, of course, fat is a person's own tissue. We harvest it from a person with a little conservative liposuction. We cleanse and centrifuge and purify the fat and re-inject it into that person. A filler is like a hyaluronic acid or calcium-based filler. It comes in a box. We take it off the shelf. It's sterile, and we can inject it with a sterile syringe and needle, etc. So that's the difference between a person's own fat and fillers, and that can be helpful in the areas around the brows, especially for someone who would like higher cheekbones, or in someone we want to emphasize the lateral part of the brow. There's something that I call the crescent of beauty. That's the lateral brow and the outside portion of the orbit going onto the cheekbone. That area, again, if you flip through the glamour magazines, almost all the models, men and women, have very prominent cheekbones and lateral brow and lateral orbit. Now, what about surgery for the eyelids? First of all, before we consider any surgery for the eyelids, we need to look at the adjacent structures. We need to look at the lower forehead and the eyebrow, and of course those structures set the stage and actually help set the position for the upper eyelid. For the lower eyelid, we need to look at the upper cheek and the malar area, because those structures actually are the foundation for the lower lid. So at another time on this program or in my office, we can talk about changing the position surgically of the brow with a brow lift, or the forehead, a lateral brow lift, or an upper cheek lift or augmentation, etc. But for the time being, please keep in mind that adjacent structures are very important when we're considering the eyelids themselves. Now, what about the upper eyelid? For the upper eyelid, I think we're really good at affecting two patient concerns: fullness or excess or heavy upper lids, and also excess skin. Now, when someone comes in the office and tells me that it's the first 2 hours of the morning, or even the first hour of the morning before someone has their coffee, their upper eyelid is very full and they'd like surgery for that, I always ask them, what about as time goes on? What about after you have your coffee or wake up, after you've moved around a while? And if they tell me that after they've moved around and had their head up for a while, they no longer have full upper lids, then typically they're not a great candidate to address the fullness. That's typically fluid, and we can talk about other modalities to help a person prevent fluid accumulation in the upper lid. But it's the person that has the very full, heavy upper eyelids throughout the whole day, maybe worse at night, who may be a candidate for addressing the periorbital fat. Now, everyone's globe, that's the eyeball, has periorbital fat that cushions and helps to lubricate the globe. But we have more than we need, much more than we need. It's held in place by a septum. It's called the orbital septum. That's for the upper lid and the lower lid. The orbital septum in some families with time gets a little bit weak, and hence the fat around the globe starts to push through and make the septum bulge. Sometimes there's actually weak parts in the septum and the fat can almost push through. That's called pseudoherniation of the periorbital fat. It's not a true hernia, but we call it a pseudoherniation or a false herniation. And that is oftentimes responsible what can lead a person to look like they have very heavy or redundant upper eyelids. And that can be easily addressed. That fat can be sculpted, removed, tailored, trimmed, etc. Now typically I do that for the fat compartment in the middle of the upper eyelid and then the compartment closest to the nose. The lateral compartment in the upper eyelid has the ever important or very important lacrimal gland that helps with tear formation. I don't like to change the lacrimal gland. I don't like to remove it or lift it up. There's a small amount of fat in front of the lacrimal gland that we can address. However, keeping in mind what I call that crescent of beauty, I like a full lateral third of the upper lid. So we can address those fat compartments conservatively and judiciously to improve a person who complains or is concerned about a heavy, tired appearing upper lid. Now the other thing that we can address in the upper lid is the extra skin. It's common for people as we're exposed to the sun and the wind, etc., to have redundant skin in the upper lid and a lack of resilience. And that skin can be trimmed away conservatively. We can leave the scar within the crease so it's minimal or minimized, hardly can be found or seen. And that's an important part of an upper lid blepharoplasty or eyelid tuck. Now what about the lower lids? The most common complaint or concern I hear in the office are the lower eyelid bags or pouches. It's oftentimes when a person will come in and ask me about removing the extra skin. It's not really a lot of extra skin. It's primarily, once again, that fat that's starting to push through on the orbital septum, that pseudoherniated eyelid fat that can give someone the look of lower eyelid pouches or very tired eyes. Now, I take a very conservative, judicious approach when sculpting, removing that fat. Sometimes I'll reposition the fat instead of just taking it all out. That's called a lower eyelid blepharoplasty. That's when we sculpt, trim, and tailor and remove some of that fat or even reposition it. Sometimes people will have a very small amount of extra skin that can be removed. I place the incision just under the eyelashes so the resulting scar is almost invisible, not quite invisible, but just about invisible, hardly ever bothers anyone. So when someone does not have extra skin, I can go on the inside of the lower eyelid. That's called a transconjunctival approach to trim and tailor and sculpt and remove and reposition that fat. When someone needs a little bit of skin removed, I can go on the outside. Now what about the tear trough? The tear trough is a groove between the lower eyelid and the nose. In some people that gets very deep and can cast a shadow. I'll oftentimes fill that area. I will release some of the tethering structures, some of the tethering ligament, the orbicularis oculi inserts in there. I can release some of that, place some of the fat in there, and I can minimize the appearance of the tear trough. Also, another common procedure that we consider is called a canthoplasty. The tone and the position of the lower lid can be changed and improved and tightened. The lateral canthal mechanism, the lateral canthal tendon, with age can become lax, and a canthoplasty can help shore that up and tighten and improve the tone of the lower lid. So those are just some of the things we can do to affect the appearance of the eyelids and the periorbita. When someone comes in and says they feel their eyes are tired or appear heavy, or they feel like they have deep grooves in the tear troughs, or they have profound pouches in the lower lid, those are some of the tools in our armamentarium. For further information about improving the appearance of the periorbita, eyelid surgery, forehead surgery, eyebrow or upper cheek surgery, you can call my office, Dr. David Morwood, 646-8661, or go to my website, drmorwood.com. I'm on the web, drmorwood.com. Once again, this is Your Health television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon. Thank you very much for joining us. I hope you'll come again. Thank you.